Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hi, I'm Dr. Gothenburg, a chiropractor in Pelican Rapids, and before we start talking a little bit about the spine today and your spinal health, I do want to mention that I also own an apple orchard, and we are in the heart of the apple season, and we're always looking for something like this. This is a 1 pound Honeycrisp apple. I take a picture of it, and we're hoping to accumulate 1 pound apples for many different varieties. The scale, it says Sears Roebuck on it. It's probably a 40-year-old scale. It came from our potato warehouse in Audubon, Minnesota. In chiropractic, there are multiple ways that doctors or chiropractors use to evaluate whether or not someone needs an adjustment. An adjustment is a means by which we change either the position or the movement of a vertebrae. Some prefer to check leg length, and that often tells a little bit about what's happening in the low back, and some techniques expand on that, and it tells a little bit about what's happening the entire length of the spine. One thing that we like to do here, and I have since I began practicing in 1983, is we use a form of palpation known as motion palpation. So by putting the person or patient into a set position, we evaluate the movements that are normal and healthy for that joint. To begin with, I have my spine here, and we're looking at the lower back. This little bone right here is one that we're all able to feel right at our waist or belt level. And what's unique about this joint is that in a standing position, when we have someone standing on their left leg and we ask them to lift their right leg, at some point the ilium moves on the sacrum. So again, the ilium pivots on the sacrum. And so that's a way that we can evaluate whether or not that vertebrae is in a healthy place or if it needs an adjustment. In the lower back, we're able to I can place my thumb on any joint, and I can have that joint, I can feel that joint as it extends, when the joint side bends, or when it rotates. In the cervical spine, this same principle holds true, where we can check for rotation, side bending, and both flexion and extension. So the question is what happens when we make an adjustment or make a correction to the spine? I try to teach people that a couple things happen that are really basic. Number one is an adjustment can change either the position or, more importantly, I think, the motion or the movement of that vertebrae in respect to the one above or below. That has dramatic effects on your nervous system, on an individual nerve, or on the muscle system that supports the spine. So when a chiropractor makes an adjustment, sometimes you'll hear a pop or a click. This is often times when someone comes in and says, well, I don't know what he did, but he cracked my back. So what happens when we make an adjustment is that the chiropractor will put the joint in stress where he feels a stretch in the muscle. If we go a little bit beyond that, we put stress in the ligament. And if we go beyond that and give it a quick impulse, this is when the patient or the person might hear a click or a pop. That sound, while it's good to hear, I guess, in a sense, it really just signals the release of gas from the joint. So they call that cavitation. The gas releases from the joint, you hear an audible pop. If I tried to reproduce that same adjustment within minutes, you would likely never hear that audible click. To bring this to an end, I think that evaluating a joint in motion is extremely important rather than simply checking someone statically. Now, statically means you are just laying in a simple fixed position. You're not moving, and I'm feeling for either tenderness or what I call a high area. If you have questions about the way you're evaluated and whether or not what I've explained to you today might be of value, then feel free to contact us here at our clinic in Pelican Rapids. Thank you.
Coming up on Wellness for Life.
Hello, I'm Matthew Koffenberg, physical therapist and owner of Back in Motion Physical Therapy in Perham as well as Park Rapids, Minnesota. Today I thought I'd talk about orthotics. A lot of times I get questions about orthotics and whether or not we should use them. So I thought I'd give you my philosophy. There's lots of different philosophies with the use of orthotics. Orthotics are items that you would slip into your shoe that kind of can help support your foot a little bit. A lot of times people with heel pain like plantar fasciitis or shin splints, a lot of times they are often in need of orthotics. I definitely am a proponent of the use of orthotics. However, you really need to make sure that you've got a proper assessment for the orthotic so that you get the correct orthotic. And then you want to make sure that you fit the orthotic exactly to fit your needs. There's so many different reasons why somebody would need an orthotic, and you want to make sure that you get the exact right orthotic. So we'll talk a little bit about my philosophy in terms of that. So the first thing you need to do with an orthotic is you've got to assess for the need of an orthotic. So the assessment for an orthotic is vast. I mean, it really takes a long time. I'm gonna break it down just to one component of it today, just to give you a little bit of an idea of what we're looking at in terms of deciding if someone needs an orthotic. There is a very common condition called varus, so V-A-R-U-S, varus, that occurs either at the heel or at what we call the forefoot. So the forefoot is just the front part of the foot. And a lot of times what will happen at the heel or that forefoot is that those bones will actually start to turn inward a little bit, and we call that a varus position. So if you look at somebody just standing, this is kind of what we would consider normal alignment. We're looking at the back of the heel, so this is depicting the heel, and obviously these are going to be the toes. So we're looking at someone's right heel, and this would be the tibia and then the fibula coming down, and again, this is the heel. Now, a normal situation when someone is just standing, that heel is going to line up just perpendicular to the ground. So we want to check to see if someone has varus. A varus is when that heel would actually be turned inward. So we assess both while they're standing as well as when they're lying prone. And I will show you an assessment here in a second of them lying on their stomach. So this picture is showing the heel of someone lying on their stomach. So this would be like the edge of the bed. The heel is going to be off the edge of the bed. And this would be someone in a varus position where that heel is turned inward. So we're going to go ahead and show you that assessment now of someone in the lying on their stomach, and I'll show you how we look for that. The assessment begins with someone lying on their stomach, and again, you want their foot over the edge of the table. And again, we're looking for varus of the heel. So here's the heel, and a varus is an inward position of the heel. I drew this line here so you could see. This would be nicely perpendicular to the floor. This would be considered more of like a varus position where it's turned inward. Now, this could be turned inward, or the forefoot could also be turned inward, and I'll show you what that would look like as well. So you want to get them in the proper position, and we call it subtalar neutral. It really doesn't matter what it's called, but we basically find the right position to do the assessment in. So this would be her subtalar neutral position. So the first thing we do is we look at that line, and it really is quite nicely perpendicular. So she does not have any, we would call it calcaneal varus. She doesn't have any varus here at the heel, which is really quite nice. The second thing that we would look for is that forefoot varus. In a forefoot varus position, what would happen, you would see, I hope the camera can pick this up, but what you would see is you would see the base of the big toe. You want the base of the big toe to line up really nice with the base of the little toe, and you really want that to be a nice straight line. And again, she does not show any varus position, but I'll show you what a varus would look like because I can position her in varus. So this would be varus. I hope you get a good idea of how that big toe now has been turned inward, and it lines up more at an angle versus here, which is where it is straight. If someone has a heel varus or a forefoot varus, that's when we want to start considering an orthotic. So after I would do an assessment of someone on their stomach to determine if they have a varus, because they might not. You know, when they're on their stomach, their heel might be perfectly flat or their forefoot might be exactly where we need it. And a lot of times those people don't really need an orthotic. However, if they do have this varus position, I'll then look at them in the standing position. And when they stand, they're either going to compensate for that or they're not going to compensate for that. So when someone is standing, if they do compensate for that varus, when they're standing, what's going to happen is this is what it's going to look like. Now remember, in the prone position, non-weight bearing, the heel was actually turned in. But then when you stand, the heel actually starts to turn outward. And when that heel turns outward, it completely flattens the foot out and puts a tremendous amount of pressure on what we call the plantar fascia. And those are the people that then need an orthotic. So how does an orthotic work in that situation? So I thought I would try to show you this. I hope that this works. I don't know if you can come down maybe right at the angle here. So this is going to depict someone's heel. This is an orthotic that we often use. And if someone has a varus position, their heel is going to be just a little bit turned inward. So what you want to do with an orthotic is you want to bring that ground up to it. So if I slip this underneath here, it's going to move the orthotic up, but it's not going to move the heel. So hopefully what will happen is that little gap will go away as this comes in. And you can kind of see how that orthotic then comes up into it. And if you look at the orthotic, it's tapered so that it's very thin on one side and thick on the other. So again, you're just kind of bringing that ground up to the orthotic, or I'm sorry, the ground up to the heel, so it takes that gap away. Whereas over here, you know, the gap is going to be there. And when the orthotic comes, it brings that up to it, and it ungaps it. So that, in essence, takes this position or that position and normalizes it by bringing the ground up to it. So that's what we want to do with an orthotic. So when I talk about assessing someone for an orthotic, that's what I mean. And when we talk about properly fitting them, we use this material. This is posting material. And again, it's nicely tapered, and there's going to be different angles. So this is a 4-degree angle of a tapering device. And we can take, what's nice about inserts is you can use any over-the-counter insert. You don't have to go out and get a $500 insert. You can go to a Walmart, your local drugstore, and you can buy an over-the-counter insert that's only like $25. You bring it in to me, and I will do an assessment to determine how much of a thickness you need to bring that orthotic to compensate for the varus that you have. So that's for someone who has a compensated varus. Now for others, we'll have this varus position or that inward turn, and they won't compensate for that. So what that means is when they're standing flat, the heel bone remains inward. So When you're lying flat, it's inward, and when you're standing, it's turned inward. What that means is that there's very little mobility in that bone. That bone is so tight that it doesn't even drop down to the floor. This is somebody who's going to sprain their ankle a lot. This is somebody who could potentially get some stress fractures because that bone is just staying right there and there's no movement and there's no collapse of that arch. This is somebody who is an oversupinator, but they just need cushioning. They don't need necessarily an orthotic, they just need extra cushioning to offer a little more support. And again, the assessment for an orthotic is very vast. If you have any foot issues whatsoever, make sure that you see somebody who's trained in assessing you properly for an orthotic and get you fit. Thank you. If you have any questions, give me a call, 218-346-2464.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.